All right, I think we can start. Good afternoon, everyone. Welcome to the Wellness Web Chat, the third in our four-part series. And before we get started, I'd like to hand over to Mary Haim to open us up with prayer.
Good afternoon, Nicole, and good afternoon, fellow team members. Good afternoon to all parents and staff who are with us this afternoon. And before we begin, let us take a moment to pause and remember that we're in the holy presence of God. In the name of the Father, and of the Son, and of the Holy Spirit. Amen. This afternoon, Father, as we put ourselves into your presence, we just ask that we become aware of your real and true presence in our lives. There are so many of us now who need to feel you and be aware of you. We ask that you lay your healing hands on those who are ill, those affected and affected by the current virus, the epidemic that has put us in a situation that sometimes we don't know how to handle. Sometimes we feel fearful, anxious, worried. Some are in pain, some are mourning. And we give thanks for the expertise of people who can help us through these times. Open a window and let in the light. And we also ask that you take our joys, our hopes, and our expectations as you guide us along this new path of life, and help us at the end of every day and always to find our way to you. We ask this in your name. Amen. Mother Bernarda, pray for us. Hail, Holy Cross, our only hope. Saint Jean-Baptiste de la Salle, pray for us. Live Jesus in our hearts forever. In the name of the Father, and of the Son, and of the Holy Spirit. Amen.
Thank you, Mary. Thank you to everyone for joining us today. For those of you that are joining us for the first time, my name is Nicole Skatemarker, and I'm the interim head of wellness and a clinical psychologist. I'll be facilitating today's wellness web chat. We have Viviana, who will be presenting on emotion regulation. She is the educational psychologist for the junior school. And then we also have Marlies and Sister Cheryl Ann, who are going to form part of our panel. So for those of you that are joining us for the first time, our wellness web chat takes place every second or third week, depending on the midterm break. And it's a four-part series where we focus on wellness and well-being. It will take place for 1 hour. And like I said, today's focus is on managing anxiety during uncertain times. Viviana will give a presentation, and after which we'll open up for a discussion facilitated by the panel. If you have any questions, comments, concerns, please use the Zoom group chat function to help us to ask your questions. All right, so we'll keep everyone on mute, and then the panel will discuss the questions coming through on the Zoom group chat. All right, I think that's all the administration. So Viviana, please take it away.
Good afternoon, De La Salle community. Welcome to our third topic in the web chat series. Following from our last topic, we felt a natural pull to present a topic around our emotional and our children's emotional regulation. It's at the forefront really during these very uncertain times. Okay. I think in this way, let's take a chance to really just think about normal, typical, what is normal actually now, but our typical sort of emotional development. Okay. Figuring things out is the best any of us can do. There is no alternative to struggling with loss, disappointment, jealousy, and failure. It is resilience in the face of these inevitable problems that characterize healthy development, not the absence of problems themselves. Okay, I'm starting off with this quote as I feel that it really does encompass our normal capacity to adapt, to grow in the face of changes, and our children's natural ability to do this. We are designed for growth, we are designed for changes, and we're designed to manage our emotions. Sometimes, however, there are little stumbling blocks that come along the way. It is also important to note when we're thinking about emotional development that with every progress, there could be a sense of loss that accompanies that. So almost, for example, a baby that learns to walk, there is a significant advancement, but there could also be a sense of loss of the comforts of dependency that the child now is losing out on. So as we develop and as we grow emotionally, there is always a conflict that we are sort of working towards. Okay, let's go on to the next slide. So when we're thinking about emotional development, we think of where it all starts. And if we think of the infant all the way up to adolescence, obviously into adulthood too, but it always begins with the development of physical boundaries. We are wanting those boundaries around us. If we think about the screaming baby that cries and niggles, that's his way of controlling his emotional experience. If we think of the toddler that throws a temper tantrums, the toddler is sort of seeking a sense of boundaries. Normal development also involves the use of physical defense mechanisms. And these are ways of protecting ourselves. And we need to keep this in mind. We all have our ways to protect ourselves. We all have our very typical ways of coping. Some of us do. Some of us need space. Some of us are more emotional, and we do tend to sort of get worked up quite quickly. And I think it's important to understand what is inherently a child or our own sense of way of coping. Okay, so if we go through natural developments and if we start with our preschoolers, we see a shift from being the dependent baby to this growing independence and assertiveness of the preschooler. Okay, a caregiver that sort of comes in and sort of refuses a child's demands becomes quite a real insult to the child's omnipotent feeling, the sense that I can do it all, and a sense of magical thinking too. So a child at this age is really holding on to understanding that if I think it, it will happen. That's how powerful they think they are. So when we place a physical boundary, which is a natural consequence for and it's a natural need for development, then we see these temper tantrums. And it is a natural pull towards emotional regulation. Okay, what is also needed at this point is that we see that language is developing the capacity to use words rather than the body. So the baby that would kick and fuss now is a preschooler that is able to perhaps use language a little bit better. Obviously, this is still a growing capacity, so there could be conflict in this as well. Then if we go on to the school-age child, we see a greater sense of external authorities becoming internalized. So they hold on a lot to what the teacher said. They hold a lot onto rules. So school becomes very important at this age. Time of rules, fairness, acquisition of self-control. It's a focus on internalizing mechanisms of competence. And this is also where we see a lot of identification with heroes and idols. Okay, and then if we go into the emotional development of adolescence, I'm kind of sort of going through this quite quickly so that we can get to the strategies, but I do think it's important that we do understand just the basic kind of tasks that each phase presents. So during the adolescent phase, there is a pull to develop identity, and in this way, the skills that they have developed during their sort of toddler years, during their childhood years, then need to mature during their adolescent years. And this involves establishing realistic, coherent sense of identity as in the context of relating to others and learning to cope with stress and manage emotions. I think what's important as well to think about now during these uncertain times is it kind of contradicts exactly what they should be doing. And so if we think of what COVID-19 is presenting with, it's presenting with a sort of disconnection from their peers, where they are actually needing their peers. They're needing to be in the context of these peers. And so the screen time is becoming more at the forefront, but it isn't allowing for perhaps more nonverbal cues and to be reading more of the underlying difficulties. We also see this actually in the preschooling years, that the need for physical connection is so important too. And that is kind of something that these uncertain times are kind of bringing to us, is how do we manage it? How do we communicate if we can't give the little one a hug, or if we can't sort of give him that reassuring little, pat on the back? So we need to be keenly aware of how typical emotional development is sort of being impacted by the circumstances that we face. Okay, so anxiety. Doing the research around this topic and sort of thinking around it, it felt useless presenting emotional regulation without actually focusing on anxiety. And I think if we think around that, there is this really strong sense that we're going through a trauma. This is traumatic. And that might sound sort of over-exaggerated for some, maybe not for others. But in any way, we look at it, it is a trauma, and we are experiencing something that is very real and very unknown. So we do need to think about it in this context. Okay, so what is anxiety? Anxiety is a very important emotional regulation strategy that we do need. And I say it's a strategy because anxiety actually is an evolutionary sort of emotion. It's there to help us survive. So if we think about the brain, we know if we could go into the full sort of neuroscience of the brain, we would be here for days. But simply put, the brain really is a sophisticated alarm system. It's there to perceive threats in one's environment. It needs to do that. It's highly tuned to the environment, and it's highly tuned through our sensory system to know what out there is dangerous or not. So the part of the brain is called the amygdala. It's the primal part of the brain. It's at the brainstem, and it's the part of the brain that regulates our breathing. It regulates our heart functions and our full functions of our body. Okay, when the brain senses a threat, real or imagined, it surges the body with hormones, important hormones, cortisol, which is the stress hormone, which I think we're all quite accustomed to during these times, and adrenaline. And the adrenaline is there to make the body strong, fast, and powerful. So sometimes if the danger is imminent or ongoing, it leaves the autonomic nervous system heightened. The autonomic nervous system is just that part of the system that acts automatically. It doesn't really give us, we don't really have control over it. It's very much a voluntary kind of system. And if we had to think about breathing, that would be quite stressful. So it's one of those things that just needs to happen for us automatically. Okay. So in fact, if we look at it from this framework, an anxious brain is actually a very strong, healthy brain. it's just a little overprotective. And it will push the panic button even just in case sometimes. And when this happens too often, then the body is then using cortisol and adrenaline chronically, and then the body is in hyperalert most of the time. Okay. I think what's also important to note is at the basis of most of our experiences is fear, actually. Love and fear, they kind of are coupled together. So even if we look at all our emotions and the range of emotions that we experience, sort of the core of all of those emotions is fear and love. Okay. So why is there anxiety in our children? Okay, I mean, thinking of COVID now, that seems more of a sort of obvious question and answer. We know that times are stressful right now. But even if we just think a little bit further beyond this, we need to think about predispositions, that some children are predisposed and they have more of an anxious temperament. Some of us do too. Also, our lifestyles, our environmental context, what we used to, we do live a fast-paced life. We do have to get things done, and so do our children. Are there underlying learning difficulties sort of that could be bringing on these anxieties? So even if we think around our vestibular systems, our proprioceptive systems, from a sensory perspective, are there difficulties in regulation already there that we need to manage? So there could be, yes, genetic, but also physiological, biological reasons behind that. And then we also look at the full sensory integration difficulties, because as we know, our anxiety sensor really is based on how our senses perceive the environment around us. Okay, so what does anxiety look like in our children? Gosh, I could go, this list is probably not exhausted, but I've listed some of the obvious ones. Avoidant behaviors, headaches, agitation, clinging behavior, separation anxiety, concentration difficulties, impulsivity, sensitivity to new and unfamiliar situations, emotional meltdowns, temper tantrums, more in our little ones, school refusal, and this could be across the board, restlessness, stomach aches, that sort of apprehensive feeling that sits in your chest, hyperactivity, aggression, peer pressure, acting out, rebellion. Maybe we see that more in our adolescence, the acting out perhaps in our school age kiddies. And I think in more cases than less, anxiety does present as anger. And I think purely because of the hormonal sort of regulation systems that are in place. So the cortisol and the adrenaline are ready for a fight. They're ready for, they are ready to sort of be strong and powerful. And so when the perceived threat is an imagined threat, it almost then kind of dissipates into this aggression. So the strategies that we're going to think about. I think, obviously, when we're thinking about the strategies and emotional regulation, what are we really saying? What is emotional regulation? And I think if we really had to unpack emotional regulation, we would see that it encompasses quite a number of skills and abilities to help bring us back to balance, to help us sort of come back to that calm, alert state. And by calm alert, what I'm intending is not that calm passive state, but that calm aware state, that state where we can function actively. So if we think of a sort of up and down bell curve, somewhere happily in the middle of that bell curve. And we need to be able to do this. Research does show us that adults who are well regulated, who are able to process their emotions, and have developed their skills through their childhood, are able to be more motivated on tasks, they're able to cope with stresses in their environments, and so the importance of emotional regulation is really there. At our younger ages, we do often need the help of our parents, caregivers, and teachers to help regulate ourselves, and this starts all the way from infancy, as the baby is dependent on its parents or its caregivers to help understand what the bodily sensations are and to bring the body into a regulated state. So that happens through our lives. As we get older, we become less dependent. But we might still need those mentors to do that, and that is still very important. So any separation from caregivers, mentors, can also create heightened anxiety. And this is what we need to think about our kids having returned to school now in these uncertain times. What kind of stress are they sort of internalizing in terms of the separation from parents as well? Okay. So when we're thinking about the strategies, we're thinking about how do we respond to anxiety. We are not fixing the anxiety. Okay, we are not taking it away, but we are managing it, and we're helping our children and ourselves to become more aware of it. We don't want to switch off the alarm system in the brain. The alarm system needs to be there, and it is an important system. Okay, so there is no quick fix to this. It is really about a management and an awareness of what is happening. Okay, so and if all our responses that to anxiety, if they ultimately nurture healthy attachment, if they are there to build security, belonging, and trust, okay, we know that we're addressing the core issues of anxiety. Okay, so in presenting the strategies, I'd like to, I can see it's a bit blurry on the screen, but I'd like to, I think it still kind of depicts what I'm trying to show. And that is the difference between left brain and right brain. And emotional regulation is exactly this. It's the integration at the sort of the easy flow between left brain functioning and right brain functioning. Okay, if we look at it from an emotional regulation perspective, the left brain is very analytical, it's logical, it's sequenced, it makes sense. It's words, it's that part of us that really knows how to analyze a situation, how to problem solve. The right part of the brain is very much focused on our creativity, our emotional expressions, which can feel explosive and eruptive, and they can feel overwhelming. But it's an important part of our emotional regulation, and it needs to have a space too. So good emotional regulation is really about integrating this left and right, which we'll get into. I'm going to add an extra layer to that, and the extra layer is thinking about that basal sort of primal area of our brain, the amygdala, which really regulates our bodily functions. Though it's where fear sort of stems from, and it's where we get the release of the adrenaline and cortisol. And then I'm also going to sort of present it as a sort of two-story house, the brain. So if you can see the downstairs part of the brain, that primal part of the brain is that amygdala which I've just presented. And then the upstairs part of the brain is that part of the brain that helps us to reason, it helps us to think, plan, problem solve. It's very much part of our executive functioning skills that we need to keep in place. And what we are saying is to keep motivated, we need to be able to also integrate this bottom part of the brain and the top part of the brain. Okay, in very simple terms. Okay. Okay, so the strategies. When your child is fearful, anxious, overwhelmed, has the sore tummy, has the sort of sleep regressions, whatever your child or yourselves are presenting with at this moment, it's important as the caregiver, as the important adult in your child's life, is to connect first. Right brain to right brain. So to access your emotional awareness and connect with what they could be feeling. So acknowledging the feelings. Using lots of non-verbal signals like physical touch, which we know is contradictory to what teachers are able to provide at this moment. Maybe within the home this is still manageable, but within a school environment, the physical touch seems to be something that we can't express at the moment, but we can still give those sort of the tone, the empathic facial expressions, and the non-judgmental listening. There is so much research around this, and how children and how even us as adults, we respond so much better when we just have that empathic capable person just providing this to us. And so validating the feelings that are real and important. So connection is so important. Then what we do during, if we're talking about a meltdown, I mean, this could work in lots of different ways, but if we're thinking about that meltdown, once we've calmed the sort of right part of the brain and we've connected with it and that part of the brain feels validated, we then can start bringing understanding. And this is where we can start exploring the fears, the real fear versus the imagined, the irrational fear, where we can normalize the fears, perhaps telling a story about how you felt like this and when you felt like that before. So normalizing it, that it is appropriate to feel this way. Also providing a sense of safety, that they are safe now, now that you've connected, that they are safe. And it's a time to start reasoning and rationalizing it. And what we call this term is name it to tame it. So it's really thinking about how do we bring words to the experience. Let's tell the story. Tell me exactly what happened. Let's go right from the beginning to the end. And what we're doing is we're integrating those very real right brain kind of emotions to the left brain understanding and allowing them to bring understanding to their experience. Okay. And then, because I wanted to add an extra element to it, I put in the vertical integration. So if we think about the house and the brain as a house with the downstairs and an upstairs, and I actually present this to the kiddies sometimes like this too, and it makes a lot of sense for them where you do present it like this. We sort of reinforcing what we spoke about earlier about that fight or flight, the adrenaline and cortisol hormonal responses. But before we can even begin to take them to the problem solving, to the sort of executive functioning in that upstairs part of the brain, we really need to soothe the system. We need to bring those stress hormones down so that we don't enrage it further. As soon as we invalidate that part of the brain that needs to be soothed, what we're doing is we're reactivating the alarm system, and it's staying in that fight or flight. So sometimes we are caught easily saying, there's nothing to be afraid of. You are safe right now. You're being silly. Don't be so silly. You're safe. And all we're really doing is, sort of activating that. Even the expression of, calm down. There's nothing to stress about. I don't think that has ever allowed anyone to calm down. So it is thinking about how do we soothe that part of the brain, and we can do this by grounding the child, by bringing them back to balance. This can be done again through physical touch. Breathing exercises are so vital at this point. So just connecting with the child, getting to their level, and as soon as we can catch a glimpse that they have sort of calmed down, that they're able to sort of start reasoning, then we can move them to that integration level. And this is vital. And I think as parents with very anxious kiddies, we sometimes do forget this, and I can relate. We sometimes do forget this. We do forget to, after soothing, to also help them through that decision making, to help them through the self-understanding, to bring them to a place where they can start controlling their emotions. And it is a very important part, and it fits perfectly with the horizontal integration that we spoke about, the left-right integration, where we spoke about naming it to tame it. And this is where that is so important. By bringing the words to it, we can activate that empathy, self-understanding, sound decision-making, and all the executive functionings that we're so able to do. We're able to think about being in the situation again, perhaps, and allowing them to problem solve. What would happen if they had to feel this fear again? What is it that allowed them to cope? What is it that made it more scary? So I think ultimately bringing them to this point is vital, because this is what ultimate emotional regulation is about. So I'll just end off there with you can't stop the waves. You can't stop them, but you can learn how to surf. Okay, so we're not going to stop the anxiety. We're not going to take away the problems. We're also not going to enable them, but we are going to try and manage it, and we can do that by learning how to venture into these big waves. Okay.
Thanks, Viviana, for that lovely presentation. It was so informative and thought-provoking. I also see that there are a few familiar names that have joined our wellness web chat today, so I'm looking forward to quite an engaging discussion. I just want to remind everyone that we do record these sessions, so if you missed a little bit of the beginning, or if you're not able to, if you don't have a very good internet connection or for whatever reason, you will have access to the recordings afterwards. So for now, I'd like to open up the floor for a discussion. So you can use the Zoom group chat function to type out your thoughts, concerns, questions, anything that you would really like the panel to discuss, and I'll open it up for my colleagues to have a discussion. Viviana, I think there were a lot of points that I really enjoyed about your presentation. And one of how you started was really helpful, explaining that we are in a crisis. These are different times. And to really think about children's resilience, right? Resilience is being able to mentally and emotionally cope with the crisis. And children are resilient. They're almost like geared towards that. And we are basically, as humans, pretty much designed to cope with crisis. And that's where parents and teachers and staff members get involved, so we can help children to be more resilient.
Yes, thank you, Nicole. I also would like to come in here just to enforce the whole concept of that fear and anxiety is a natural emotion that takes place. You can never take that away. But when it overrides all our other emotions and it takes away our logic to actually manage the problem, then it becomes a problem. So to regulate emotional feelings from a very small age is extremely important. So this talk is for everyone, Viviana. It's for adults, it's for children, and it's really, really the way to go.
I see a few comments coming through. One of the participants have asked if there are any natural supplements that we would recommend to help reduce stress hormones like cortisol or like too much anxiety. Any comments, Marlies or Viviana?
Viv?
I suppose it's not really our area, but there definitely is sort of holistic ways of managing this, and it's something that we did want to bring into the conversation. Is this is, if we approach it from a team approach, we really can manage the sort of anxiety levels. So yes, I would definitely feel very comfortable, and I've worked very comfortably with sort of homeopaths. They definitely know how to recommend and sort of look at what a certain sort of blood makeup would need in terms of natural supplements. So they definitely are. Just off the top of my head, there's things like Mentats and Stress Away and things like that. Not that I recommend those or prescribe those, but it is something that you can look into and that there is availability to. And I think these, in conjunction with the strategies that we presented, as well as with perhaps therapeutic processes, understanding the causes of anxiety always works well hand in hand. OTs are also phenomenal occupational therapists in helping to manage this from a holistic point of view, and making sure that we are sort of going underneath to uncover what it really could be about.
Yeah, definitely. I think there is definitely, I won't also comment on exactly what there is because I'm not too sure. I'm not a pharmacist or a doctor, but definitely there are supplements, even natural supplements, especially what I would like to do, and obviously movement. The moment there's movement or exercise in the body, it just gives you that release of a hormone that actually makes us happy again. So I always, when I've deal with depression and things, the first thing is please go exercise, even if you just walk. Those things, those natural things are definitely important as well.
Absolutely, Marlies, and I think that is important to note, because when we are thinking about that sort of built up adrenaline that is in the system, the exercise also helps to burn all of that up as well. So what we're doing is we're using that adrenaline in constructive ways. And once we're using it in constructive ways, the body feels a lot more in sync and balanced, because it's using it appropriately rather than in ways that feel a little bit more destructive.
I see, sorry, Nicole, I see there's someone that asked about sleep disturbances. Sleep is our natural healer. So it can either bring out our natural desires, and if there's a problem, it also brings out nightmares. And it will show. If the child has anxiety, it will definitely come out in sleep, in nightmares. So it's also a way of the brain healing, because allowing those things to come out and express it rather than repress it, so that we can actually realize it and start dealing with it. Sorry, Nicole, I interrupted you.
No, absolutely. Thanks for that. You know, I think that links to what Viviana was saying about the list of anxiety behaviors. Is that what you called it? And I think, you know, it's also important to note that it's different between the kiddies and the teenagers. So, you know, children are not able to articulate or to verbalize their anxiety. They're not really able to understand like we are as adults. We've got the frontal lobe, the part of our brain that helps us to rationalize and reason. But this part of the brain is not developed for children or teenagers yet. In actual fact, it only stops developing at the age of 25. So we're asking children to rationalize their irrational fears, but they actually can't. They haven't learned how to yet. And that's what we do as parents and teachers or therapists even. And for kids and teenagers, because they can't verbalize it or understand it, it comes out in different ways. So we look at what is the body trying to communicate. Okay, sleep disturbances, anxiety, or, you know, headaches or stomach pains, and all of the anger, like Viviana said. You know, things are being communicated that children are not able to articulate just yet, like we are as adults.
And just following that, what you just said, Nicole, there's also a question that says anxiety can also be unrealistic. So without minimizing their feelings, how do you explain which fears are irrational? And that's again that you cannot minimize it totally, but it's also important then to regulate those emotions which they will struggle with, as Nicole explained, because they're not dealing with it appropriately yet. But as they understand why are they so scared, and they don't need to be so scared for instance, the English test. It's just the English test. And what is so bad about it? So without minimizing it and saying to them, I understand that you have fear. That's very natural. But when it controls you, it's not okay anymore. And how do we control this fear? Because you're in control of your life, so you control everything. So yeah, to regulate that would be great.
I think it's easier for us as adults to think, oh, it's an English test, like you'll be fine, calm down. But like Viviana said, that's not very helpful, because for them it's the English test and they have to do well, or they have to achieve a certain thing. And so like she said, you know, it's important to validate those feelings. then once the child has calmed down, to then reason with them and try to understand how they can learn from the experience, almost taking it like a step-by-step process.
And I think it's also just meeting the child where they're at. So the irrational fear to them might not feel irrational. And so labeling it as irrational at that point isn't also helpful. So it's helping them work towards, and it does sometimes take a lot of creativity on our side to do that, but helping them towards sort of validating, but practicing using that part of the brain that Nicole mentioned isn't fully developed, and it can only really fully develop, it's like a muscle, it can only really fully develop with the exercise. Otherwise, it remains a little bit of an unregulated, part of the brain. So we do need to exercise it, and that's meeting the child where they're at that moment.
Thanks. I also have a question here from another participant. How do parents manage their own anxiety and keep themselves calm when they feel like they're losing it, especially when their children are losing it? And I'm smiling because this isn't the first time we've got this question. I think it comes up with each web chat, the experience of parents feeling like they actually are not in control and they're losing it, and how do they manage their own internal anxieties and worries and uncertainty around this pandemic, and then how do they manage that in relation to their children? Viviana, Marlies?
So there's a wonderful expression called parenting from the inside out, and I really resonate with this term because it really helps us to think about what our natural triggers are for ourselves. So, and it really brings us to think about our own self-awareness. And I think to have that self-awareness is not to separate ourselves completely from our children. I think it's important that we model that we do have feelings and we do have experiences and emotional experiences. But what it does extra is that having that sort of emotional awareness, what it does is it allows us not to project it into the children, and it allows us to own it for ourselves. So I think getting that support in any which way that a parent needs is vital during this time. If it's through a support group, if it's through therapy, if it's through a book club, if it's through just being able to connect with other parents in ways that make sense, and that brings that self-awareness to the core. So, but also to think about what I also like about parenting from the inside out, and that term is that it also evokes this idea that that our brains also need to be acknowledged, and our emotions also need to be validated, and so the fears that we have are also very real. So take the time, get the support you need to help you through this.
Thanks. Also, another participant has said, it's very difficult as a parent to remain motivated with the schoolwork. They're feeling over it. It's a lot of workload. The children are also feeling out of sorts. The parents feel out of their depths, and they're not really sure how they're supposed to be getting through everything. So they're also wondering, and I know it's difficult for the wellness team to comment on this, how seriously should parents be taking the children's school marks this year? And the question is particularly with the junior school, because parents have been doing a lot of the teaching actually. I think it's quite difficult for the wellness team to comment on that, but Marlies, maybe you have some insight about that, about the parents' lack of difficulty with motivation at the moment.
Well, that's totally understandable. I think we need to be very, very flexible during this time, as we've not experienced any of this before. It was just also the teacher's way of getting a grip onto things, and I'd rather have more work than less, not to overwhelm. But especially when the children are in the primary school, I always say it's not about the completing that work. That could be completed through the year. That's not a problem, because children get very anxious. I need to do this. I haven't completed it. And we teach LO to the little ones. And to them, I said, it's okay. We'll catch it up. That is beside the point. Unfortunately, when you sit with matrics, and I can't also comment here because I'm not in a high school, but when you sit with matrics in grade 11, there's different things. There is a curriculum to cover. It's not all about that, and it will be, I'm sure the teachers understand and they help this process. So it is from child to child, but when it overwhelms, then surely we can find a way around it.
So I'm aware that we have about 10 minutes left. So if there are any more questions or comments, try to get them through in the next couple of minutes for us to address. I suppose while we wait, I'd like to maybe ask the panel just for some closing thoughts, if you have any.
If you want to say something.
Okay. I think this topic is something that is very real for many of us, and even just thinking about what parents are going through at the moment in terms of managing things, just to acknowledge that this is hard, and right now we are in survival mode. We can't, like I said, we can't switch this alarm system off in our body. It needs to be there. We've just got to survive this and somehow manage it to the best of our abilities to build that growth, resilience, and adaptability. So yeah.
And I just think that this whole process is teaching every one of us to connect, to reach out to each other, to be aware of our emotions. This Zoom chat shows us that we can actually connect as a community and actually get stronger through all of this and carry each other. So I think we just need to keep that in mind.
Mm. Yeah, just to echo what Viviana and Marlies have said, it's okay not to be okay. It's okay to be struggling. This is a really difficult time. And yes, we can look towards how much we're going to grow, but right now it sucks. And it's okay for us to acknowledge that. It's really tough. I think on that note, I just want to remind everyone that if you are struggling, to please reach out, either through the helpline, is the junior school or the high school, or you can email Marlies, Viviana, or myself. So there are avenues to reach out. I think just as we're about to wrap up, Marlies, you'll be presenting the final wellness web chat. Do you maybe have 1 or 2 lines to promote it?
I think it's also how to deal with life now that we're in the new normal, how to deal with family life that we're in the new normal, because we are changing and we are hopefully evolving. So it's basically around that.
Family life. So the information for that will be made available next week. It will be sent out to everyone. But for now, I think we are ready to wrap up. Like I said, if you need to, please reach out. Please don't hesitate. And the recording will be made available. Other than that, I want to thank everyone for joining us today, all the parents, all the staff members. It's really nice seeing some familiar names with each of these wellness web chats. A big thank you to the panel and to Viviana for presenting. And other than that, for now, goodbye, keep well and stay safe.